Hear ye, friends. Tonight's case starts with the oldest power in public health, the right to walk in. When a contagious disease shows up anywhere in this country, a school, a restaurant, a meatpacking plant, health investigators walk in, see the patient, and read the records. That is the whole system. Tonight, in Aurora, Colorado, there is a building where they cannot walk in. It is a federal immigration jail. It has an active tuberculosis case inside it, and the company that runs it is holding the door shut. Remember the door, jury. The door is the case. The standoff. On the record. The Aurora ICE processing center is run by GEO Group, a private prison contractor. Colorado issued a public health order on June 25th over active tuberculosis at the facility. Since then, per the reporting, GEO has denied investigators access to the infected patient. It has withheld the medical records. It has refused to hand over the data showing where detainees were moved, which for an airborne disease is the contact tracing map itself. Health officials set an access deadline this week. The company's answer so far has been the door. How many people are infected? That, jury, is exactly what nobody outside the wall can say, and the numbers on offer do not agree. Officials have confirmed one active tuberculosis case. A detainee told The Guardian that at least 12 people inside have tested positive. ICE says there is no outbreak. 1, 12, or none. Pick your source, because the investigators whose job is to settle that question are standing outside the building. When the operator controls the door, the operator controls the count. Now the exhibit that turns a health story into tonight's case. While that standoff was running, the federal government awarded GEO Group a new contract, 5 years, $529 million. A second Colorado facility, in Hudson, with 1,188 beds, that will, in the words of the policy bulletin, nearly double the state's ICE detention capacity. Read the calendar with me, jury. The company was actively refusing a public health order with one hand and signing a $500 million expansion with the other. Same weeks, same company, same government. Cross-examination. Because even this deserves its fair reading. GEO sits in a genuinely tangled spot. A federal contractor, answering to ICE, being ordered around by a state health department, and federal facilities do sometimes contest state jurisdiction. There are medical privacy rules a lawyer can waive, and ICE's denial that there is an outbreak is entered here in full on the record. But notice what none of that explains, jury. Jurisdictional lawyers negotiate. They do not stonewall for 3 weeks. Privacy law has an exception the size of a barn door for public health investigations. And if there is truly no outbreak, the fastest way to prove it is the thing the company will not do: open the door. So who benefits from the wall? Follow the incentives, because they are the whole indictment. If stonewalling a disease investigation cost a contractor its contracts, the door would have opened on June 26th. Instead, the reward arrived mid-standoff. Obstruction met with expansion. A company that just demonstrated it can wall off the state's health authority was handed nearly twice the footprint to do it behind. Whatever the intention, the lesson every federal contractor just learned is that the wall works, and the wall pays. And the cost sits with the people who cannot leave. Roughly 1,249 human beings are detained inside Aurora right now, breathing shared air with a confirmed case of an airborne disease, while the investigation meant to protect them idles outside the fence. Add the guards and staff who go home every night. Add the families and neighborhoods they go home to. Tuberculosis does not respect a perimeter fence, jury, and neither does the precedent, a public health system that can be told no by the very facility it most needs to see inside. The verdict, jury. And this one is about the pairing. Maybe it is one case. Maybe it is 12. The scandal is that the answer is currently a matter of the operator's permission. A private company is holding the door against a disease investigation at a facility it runs for the public, and in the very same weeks, the public handed it $529 million to nearly double in size. An airborne disease behind a wall the company will not open, and the reward for the wall was $500 million. Demand the door, not the press release. Court is adjourned. I'm Madeline, and this is Pixel Politics.